The new hospital has allowed us to review our clinical practices and, where appropriately, to aggregate wards or departments together. This means that wards or departments that were previously at opposite ends of the old hospital, or indeed on different sites, can now be brought together. This facilitates greater care, but also greater dignity for our patients.
For example, ambulatory care has been designed specifically to allow an increase in the number of patients undergoing day case surgery, ensuring that beds previously occupied on wards are now released for patients with long-term medical or surgical procedures. There are 84 ambulatory care day case beds or positions with their own dedicated theatre complex of 7 theatres with easy access for both patients and staff on floor 0. This means that patients who have short stay procedures can be up and about and be discharged through the dedicated discharge lounge far more efficiently. Ward layouts have been designed specifically to suit the needs of patients, with 44% of rooms being single occupancy. Wards have been designed to facilitate dignity in care, with patients being taken from a ward or to any other part of the hospital, including the mortuary, without the need to go down any of the main corridors. Wards have been designed to ensure used and clean linen are stored separately and rubbish can be disposed of without the need for porters to come onto the ward.
In order for us to become more effective and efficient at everything we do, and in order that we can offer patients the best in treatment, services and facilities, we've actually undertaken a wide-ranging and far-reaching review of all of our clinical and non-clinical equipment.
The latest electronic theatre control panels will allow staff to specify or modify theatre settings at the touch of a screen. This means less time adjusting the equipment and more time focusing on patient care. Arjo's Primo recumbent bathing system has been selected for the Trust. The equipment includes pictogram instructions to assist staff. All actions such as lowering or raising the patient, filling the bath and operating a shower are controlled at the touch of a button. Arjo's MaxiSky is a ceiling lift that allows patients to be transferred in a comfortable and dignified way. For staff, it offers an easy-to-operate system that eliminates lifting.
Of course, we all know the importance of infection control, quite rightly. The design of the new hospital has allowed us to improve on previous infection control procedures, and isolating patients either in side rooms or in cohorts will help do that. Also, at the entry of every ward are hand wash stations and clinical rub stations. Everybody is going to be encouraged to use those on entering and leaving the wards.
Infection control and prevention has been a major priority in developing the new hospital, and a number of new and exciting initiatives have been designed into the build. Single rooms have their own ensuite facilities, and the 4-bedded bays their own bathrooms, all helping to prevent cross-contamination. All shower facilities are operated via a hand sensing system, which requires no taps to be physically turned on or off. Curtains on the ward are made from a new material, which not only carries the message "Do not enter," but is also designed to help prevent infection spreading. There are no radiators. Instead, heating is provided through ceilings, thus eliminating the problem of unwanted material collecting behind traditional radiators. The benefits, in summary, are better, more efficient and more comfortable care. QEHB represents a significant investment in the health services for Birmingham and the Midlands. It will provide a wide range of benefits that will greatly improve patient care. It is a hospital built to the very latest healthcare standards, improving still further the quality of care our clinical teams can provide. All our services will be under one roof for the first time, helping our emergency services in particular to provide care precisely when and where it is required. Despite its size, the hospital is designed to operate on a human scale, putting our patients at their ease. Bright, welcoming and calm, The new hospital is designed specifically around the needs of patients and visitors, making coming to hospital easier and more pleasant. For example, there will be dedicated patient and visitor lifts, with other lifts available for staff and the moving of goods. QEHB allows us to support new ways of working that benefit both patients and staff. Building the new hospital is allowing us to invest in cutting-edge equipment, bringing our services right up to date with the latest medical advances available to the NHS. We can organise services in the most efficient and effective way so patients get the best and quickest service possible. We're able to provide more one-stop clinics, meaning fewer visits to hospital. We can carry out more day surgery so patients do not need to spend so long in hospital. Specialities can accelerate their service improvements. For example, renal patients will have access to dialysis on their ward.
In the QEHB, we have one of the finest new hospitals in Europe, which is important. But it's not as important as the 7,000 staff who work here and who deal with 750,000 patients across Birmingham, across the West Midlands and across the UK. I'm proud to work for the Trust, and I hope you're going to be as proud as well. I also hope that you are professionally satisfied while you work with us. Welcome to the new QEHB.